Hey everyone, Dr. Cervone here with Cumberland Chiropractic and Sports Medicine. Today we're wrapping up our series of videos talking about chiropractic adjustments. Today we're going to be talking about cervical adjusting and adjusting the skull. This is the one we probably get the most questions about and see patients get most anxious about before we do it. So hopefully by watching this video we kind of ease some of your anxiety about it, and you can see how it's such a powerful tool and how we use it to get you better faster. So like I said, we're talking about cervical adjusting today. So adjusting the neck and adjusting up at the skull here. And it's such a big, powerful tool we can use to get rid of things like neck pain, headaches, radiating pain down the arm, even some mid-back pain stuff. So Dr. House is gonna be our patient today. He's got some issues we're gonna be working on. First and foremost, we're taking a good history. We're doing a good exam. We're trying to make sure he's going to be a good patient for a cervical adjustment. If any of these big red flags pop up, he's probably not going to be a good candidate for this, and we're going to look into some other options for him. But we've screened him out, he's good to go. So we get right into our palpation here. So I bring Dr. House back. So we are just looking for what motions he is lacking, not necessarily where his pain is at. And as I palpate here, he lacks a little bit of extension and a little bit of this left lateral bend and a little bit of this right rotation. So what we're gonna do is we're gonna apply that force into the joints and just get some movement in it. So as I set up behind him, I let him lean back into me. He's nice and relaxed. This is all about him being very calm, relaxed as we're doing this. So I'm supporting him. I can support his head here and just kind of bring him back a little bit. We're gonna let him nice and easy just kind of fall over. So he's extended, he's lateral bend. We rotate a little bit and we press. So that's what an adjustment looks like sitting up in the chair. But let's say as we're setting up for the adjustment, you feel a little pinch, something just doesn't feel quite comfortable, patient can't relax. We can always do a supine adjustment too, and this is what most people I think are most familiar with. And doing it this way, you just release some of the muscular tension around that you don't have to support your head so much, or you don't have that anxiety of sitting up and trying to relax so much. So Dr. House is supine here, and I'm just gonna palpate again as I always do before I adjust. And I just feel a lot of muscular tension up here around the base of his skull. So the first thing I'm gonna have him do is just scoot back a little bit, and we're gonna release some of this muscular tension around the skull. And this is a common spot back here in the suboccipitals where we see a lot of headaches start. Some muscular tension back here that can put pressure on some nerves that give you that kind of hat band type tension headache sort of thing. So I'm just gonna show a real quick release here where I have him kind of tuck his chin and I kind of push down on his forehead where I give a nice little stretch on those muscles. And by doing this first, I release some of the muscular tension around those joints, and it makes the adjustment go a lot smoother. So we would do that for a couple rounds, release some of the tension. The joint still feels a little fixated, so I can set up and do an adjustment from this angle too. Okay, so let's say even doing the supine adjustment, you still feel a lot of tension, or patient is just very, very nervous about getting adjusted, doesn't want their neck adjusted, which happens quite a bit actually. What we're gonna try to do is get some motion into those areas of the spine where you need them without the high velocity adjustment that kind of scares a lot of people. So what I'm gonna do is just kind of get down here where his cervical spine meets his thoracics, down by the shoulders. I'm just gonna give it a little pull up, and we're just kind of tractioning it up a little bit. We do that same kind of chin tuck that we did to stretch those muscles at the skull, and I give a little push down. So now we're getting motion between the skull and the cervical spine. I'm supporting his head with my knee so he's nice and relaxed, and now we just real easy start to extend him back. So he needed that extension, he needed that lateral bend. So we put that motion into the spine, nice, easy, controlled, without that thrust that kind of scares everyone off. So I hope this video and the series of videos we've been doing the past couple weeks really kind of eased some of your fears you might have about getting an adjustment in the office. But if you do still have some qualms about it, talk to me, talk to Dr. Moore, talk to Dr. House, so we can pick the appropriate treatment for you and get your problem better as quick as we can. The adjustment is such a big part of our treatment plan, along with the rehab and the soft tissue work we do here. So if you have any questions about it, make sure you're asking us. Like this video, share it with your friends and family, leave a comment or a question. This has been Dr. Gary Chavon with Cumberland Chiropractic, where we get you better faster.